Hello, everyone, and welcome back to the Original Medicine Podcast. My name is MG McCullough, and I'm a classical Chinese medicine practitioner. And in today's episode, I'm going to talk about why TCM, traditional Chinese medicine, is actually not traditional at all. And the most important aspect of this conversation is why that matters for you. Why is it important for you to understand the difference between TCM and what we call CCM, classical Chinese medicine? What does it mean? What are the differences? And what are the potential differences for your health and for your health outcomes? So let's get into it. So when we all go to acupuncture school, when we acupuncturists go to acupuncture school, what we're trained in is TCM. And TCM stands for traditional Chinese medicine, which has become synonymous with acupuncture across the world. I have relatives that live in China, and they easily refer to acupuncture and Chinese herbs and Qigong and all the things as TCM. It's just become synonymous, okay? But there's a little bit more nuance to it. And TCM truly, factually, was created in the 1950s. When Mao took over China, he wanted China to become modern and Western. And so one of the ways that he was going to do that was he banished the practice of acupuncture. There were all kinds of social and political disagreements, just as there are in present day in countries everywhere across the world. But one of the things that he decided to do was to stop the practice of acupuncture. So after a period of time, people were sick and they didn't have enough healthcare. So he said to his cabinet, which is called the Imperial Academy, let's bring back acupuncture, but I want you to instead make it exportable. I want you to make it condensed so that we can teach people who are not acupuncturists, who are not medical doctors, how to use acupuncture, go out across China and help people who need it. This is where we get into the details of what came before TCM, because TCM is what we are taught in school. This is what we take board exams on. And basically, it's these collections of points that come from channels and are grouped together based on their ability to treat symptoms. So if somebody says, I have back pain, then you do point A, B, C, D. If somebody says, hey, I have digestive trouble, then you do X, Y, Z. Okay. So these are the things that we learn in school. And we do learn the philosophy behind why this is. But in comparison to classical Chinese medicine, it is a watered down version. The philosophy behind it is watered down. The treatment itself is watered down. And that's what I want to get into now so that you understand the difference in if you have seen a TCM practitioner and you didn't quite get the results that you were hoping for, or maybe someone referred you to their acupuncturist because they got amazing results. But for you, it was just kind of like, well, I didn't really make any improvement. I didn't feel different. I didn't have, my symptoms didn't get better. So before Mao took over China, we had in practice what we call, or what I've been taught was called the complete system of acupuncture. And this meant that we had something called the primary channels. And then we had what my teacher calls the complement channels. So the primary channels are those 12 channels that all of us acupuncturists learn about in school and that you've heard about. If you've ever been around acupuncture, you've been to an acupuncturist, if you've read anything online, you've heard about these 12 channels: the liver, gallbladder, large intestine, small intestine, stomach, spleen, and so on, right? They're very recognizable words because they are organs that we know in modern biology. Okay, so they have still the functions that we think of in modern biology, but they have additional functions as well. So the lungs, for example, obviously pertain to breathing, just like they do in our modern biological understanding of the body, physiological understanding, but also in Chinese medicine, the lungs send energy down. The lungs are also associated with the emotion of grief. And that's really a more modern interpretation. Again, a simplified version, which does make sense. But if you get into it a little bit more deeply, what you realize is that the grief is a product of a lack of connection. So a lot of us experience grief by not being connected from the time that we were born. When we are born in a difficult birth, like maybe we as babies are challenged by the birth experience and we have something medically wrong that needs immediate attention, we are whisked away from our mothers because we need immediate life-saving attention, right? But from an evolutionary standpoint, from a psychological standpoint, this is threatening our very survival, because what is intended to happen is that you go right to your mother's breast. We're just speaking in very basic terms. So sometimes long term, we see effects of a lung that is not doing what it's supposed to do, which is to send energy down in the body because of a separation that occurred for completely good reasons. This is not a judgment. It's just how the channels form, how the organs respond. And the point in me giving you this example is that primary channel was affected initially by the separation of the baby from the mother. But this does not mean that as an adult, a problem that you have a respiratory problem. Another way that we see problems show up in adults with regard to the lung is digestive problems, because the lung is partnered with the large intestine as a metal element. So if you have been around the acupuncture world or you've been reading about it, you may have heard of the 5-element theories. This is referring to all the organs not only have emotion, but they also have elements. And so many things are interrelated in Chinese medicine, and it's not quite as cut and dry. And we do in modern acupuncture, in TCM school, we do learn that there are relationships between things for sure, but it's just watered down. So for example, in TCM school, we were not taught to think about how the lung connects to the large intestine, because the lung sends energy down. But we also wouldn't be really taught to how to address this, because modern acupuncture, and I use the term modern acupuncture interchangeably with TCM, because as much as we in acupuncture school are taught that acupuncture is thousands of years old, what we're actually learning is not thousands of years old. It is about 75 years old. It was created in the 1950s, and so therefore it is created from a system that was thousands of years old itself. Is not very old at all. And that's neither here nor there. Something can be new, it can be old, and both be effective. But the point I'm trying to make here with the example of the lung is that by the lung running into a problem at such an early stage in life, right at birth, this creates a problem often in the 8 extraordinary channels. And this means a level of energy that is the deepest in our bodies, truly like the blueprint of who we are. We could also say DNA. People who have inherited diseases often fall in this category. When people say Parkinson's disease runs in my family, that would likely, in most cases, fall into the 8 extraordinary category. We would treat with this group of channels. You would be very likely to find an 8 extraordinary pulse in someone's wrist. I don't think I've talked very much about pulse on this podcast. Perhaps we can do a different episode about that. But pulse diagnosis is also a classical practice that is used somewhat in modern acupuncture, but not to the extent, the depth of practice, I don't believe is there. At least in my experience, what I learned in acupuncture school pales in comparison to what I've been taught by my amazing teacher, Anne Cecil Sturman, in the classical realm. There's a lot more information that can be gathered from people's pulses. And what this means literally is feeling positions on the wrist. You're feeling the radial pulse in 3 different positions. And this tells us information about the organs and also the channels, as well as how, again, they relate to each other. How do the organs talk to each other or not? And then that gives us a bigger and more thorough picture of what's going on for a patient. And then that way we can treat more appropriately. So again, back to this example of the lung issue. If we are seeing a TCM acupuncturist for, let's just say, digestive problems, because that's really common, right? And this TCM acupuncturist says loose stools or frequent diarrhea, and then sometimes like you also are constipated. So perhaps we could use large intestine points, right? So this acupuncturist, based on their training, is thinking we could use points from the large intestine primary channel, except for the primary channel functions to keep us alive 24/7. So anything that threatens the primary channel is going to require the help of the complement channels. As I mentioned before, when the lung is negatively affected at birth, that's super early in life, right? As early as you can get. That is not going to be a primary channel problem. That is going to our deepest layer, the yuan layer of energy. But this is affecting the 8 extraordinary level of energy. So if we get treatments from our acupuncturist who's completely loving and well-intentioned and wants the best for their patients, probably your digestive problems are going to improve a bit, and then they're going to revert back to the same problem, because where the problem, the original injury to the body, is that disconnection from the mother. So grief has affected the lungs at the level of the 8 extraordinary. So if we're not using that level, it's going to be very difficult to produce a lasting change in that patient. So then that's a patient who comes away from their acupuncture experience saying, gosh, I love my acupuncturist. They're just like the most wonderful person. I always feel better when I leave. But if I stop going, my symptoms come right back. Or, I have to keep going in order to see the benefit, but they can never stop. It's great to manage symptoms. Any of us who have had any chronic symptoms or even acute symptoms, it's wonderful if you can get those symptoms to stop, but we have to look at what we're doing. And if we're not getting long-term benefit, I think we have to question the method that we're using. In Chinese medicine, we're very aware that short-term gain can come at a long-term risk. A really quick example of that is when we have a cold and we take cold medicine that suppresses our symptoms. That can be a very dangerous place to be, because it has to go somewhere. And in our Western minds, we are not trained to think, where do those symptoms go when we suppress? I'm not by any means trying to say that we should never suppress symptoms. I do think there's a time and place. Obviously, everyone chooses for themselves. I'm just saying simply that the Chinese medicine system sees the body in different ways, and that everything is truly related. So when you have those symptoms of a cold, you're talking about symptoms like at the surface. And then when you take NyQuil, you are suppressing the symptoms. So you're pushing it down into the body. Literally, suppression means to push down. And so in Chinese medicine, down would be to a deeper level. Well, again, we've just talked about the original injury as a baby was the disconnection from the mother because you had a life-threatening situation. You had to be attended to immediately. That creates a deep level injury that we can realign through acupuncture treatments. So then I've heard people say, my acupuncturist says that they use 8 extraordinary channels all the time. They just put those needles in and they combine it with other things. Absolutely not. That is not how we treat 8 extraordinary channels. When we're using 8 extraordinary channels and we're using them in the truest sense of how they're intended from a classical medicine perspective as opposed to modern, we need a certain needling technique so that we are waking up that level of energy. So the 8 extraordinary, as I've mentioned, is a deep, deep layer of energy. We can't just put in shallow needles, and we don't just put them in as slyly as possible, right? This is a treatment where the needling is deep. There's a vibration because we are waking up the yuan level. And we need to send a very clear message to the body that we are indeed trying to treat this deep level. So in my mind, I think of this deep level of energy like the foundation on a house, that you can have maybe like a problem in one side of your house, like with the roof. So you get a roofer out and they fix the shingles. And then 3 or 4 months goes by and then you've got that problem again. And then maybe a few more months goes by and like something like the siding on your house isn't quite right, or maybe the window doesn't open. And so you call somebody for that, right? But the whole problem is that the foundation of the house is not right to begin with. And so it doesn't matter how many times you fix the roof until you fix the foundation, you're not going to move forward without problems. I hope that that is a good comparison in your mind if you think about not having a sturdy foundation. And this can be what is going on for a lot of people for a lot of different reasons. The lungs are just one reason, just one example that I thought of off the cuff here. But I see a lot of 8 extraordinary pulses in my practice. I see a lot of 8 extraordinary pathology in general. I think it's very common for a number of reasons. And so What I'm saying is, if you have an inherited disease, if you have something that has been really tricky for you to get help with, whether that is in allopathic medicine, whether it is in acupuncture, it may be that you have a deeper level of energy affected than what a TCM acupuncturist is trained to treat. Because in school, in TCM school, we do touch on 8 extraordinary treatments. But just like this acupuncturist that I heard from who said, yeah, I use them all the time. I combine points with other channels. That's like an egregious error. That's not how we do extraordinary channels at all. And so therefore for you, the patient, you're not going to get the results that you otherwise could because you're working with someone who just simply doesn't have that body of knowledge. It's nothing that they've done wrong. They don't know that they're practicing in this way. They don't understand because their training has not trained them in that way. They got a TCM education just as I did. It's just that because I was injured by TCM, I was seeking out other things. I knew I had heard enough from some teachers that at my school that had studied with my teacher Ann's to know that there was something more and that I wanted to know what that more thing was. So anyway, that's why I like to talk about this topic, because I think like acupuncture holds like huge keys to well-being for so many people. And honestly, just like the planet in general, like if we could benefit from these tools, if more people could benefit, I think we would be in a drastically different place. But if all of us that are practicing acupuncture are practicing this surface level where we're just only using the primary channels, it's like organizing a hoarder's home without cleaning out the junk. You can put things in nice, neat containers, but until you get rid of the junk, it's not going to actually make a difference in the hoarder's house, okay? And so in the complement channels, there are ways of releasing things that no longer need to be stored. The complement channels functioned in the moment to store something away so that the primary channels could continue functioning and continue keeping you alive. But then over time, you didn't have the skills or the time or the space or even like the physiological resources to get rid of those things that you've stored. So now you're starting to develop a different problem because you have all the stuff stored. So classical medicine treatments are a really unique, delicate combination of not only releasing things that you no longer need, that now you have the time and space to release, and also helping you to rebuild resources that will also do that. So if you've listened to other episodes, you've probably heard me talk about mediumship. This is a really important concept in classical Chinese medicine that is virtually lost in the modern practice of acupuncture. TCM does talk about blood and it talks about yin, of course, but it doesn't get into the specifics of thin and thick fluids and how these physiological functions like work together and also work together to put chronic disease into remission. So this is my mission, to spread the word that there is a significant difference between TCM acupuncture and classical Chinese acupuncture because of what was lost. So TCM absolutely serves a purpose. And I honestly think that the story of the barefoot doctors is such an interesting one where I don't know if I mentioned this earlier in the episode, but that's what the people who didn't have any other medical training and were trained in TCM back in the 50s in order to go out and help people across China were called. They were called the barefoot doctors. And I think that is so fascinating. And we need that. And if you've been around here for any time or you connect with me on Instagram, you know that I'm really big on trying to promote Chinese medicine for non-acupuncturists. I think it's really important that people learn how to take care of themselves, how to treat themselves when they're sick, because it makes a tremendous difference in your outcome, not just immediately in an illness, but long-term in the ways that we do or don't develop chronic disease, because all the things are related. So as I talk about this and wanting more people to understand the difference between classical Chinese medicine and traditional Chinese medicine, the reason is truly not to hate on TCM, but just to say that it is such a tiny fraction of the big picture. And so if you are a person who is looking for results that you haven't been able to get, expand your search. Look for someone who's trained in classical Chinese medicine who really treats based on the principles of the medicine versus chasing your symptoms, because all of us want to help our patients with their symptoms. Absolutely. When someone comes in and says, you know, my shoulder hurts or digestion is terrible or I can't sleep, of course we want to help people with those symptoms. The thing that is bothering them, we really do want that to go away. However, if we don't take into consideration the full picture of Chinese medicine physiology and we jump right to this point treats this thing, we can often be wrong. As opposed to if we truly evaluate someone's story, when did their symptoms start? What was happening in their life before that? Tell me about your early life. What was the tenor of your household when you were growing up? What's the tenor of your household now? What is your work life like, right? When you get into those deeper questions that paint a picture of the environment that people are in, do they have any time for themselves? Do they have any support? What is their diet like? Are they eating a wet, warm diet that's hydrating, that allows their body to build medium? These things point to a drastically different picture rather than simply asking if your back hurts. Back pain can be a multitude of things. So I hope genuinely that these examples that I give help you to see the differences in if you are treated by TCM, your outcome can be really different. Most of the time, you're going to get some improvement, but if you're not actually getting better and you've been working with someone for a long time, I would suggest that you try to work with a complement channel practitioner, someone who practices classically, who's going to evaluate the whole picture. In TCM, we're trained to ask a lot of questions. There are these things that they call the 10 questions, and they're required in school clinic that you ask people all these things, but they're wildly unnecessary and they're wildly useless if you don't have deeper information. So it doesn't matter if you run hot or cold or how many times you urinate per day. I can't even remember what the questions are, right? But they're just really mindless in comparison. And it doesn't help us as practitioners get to the root of the problem, which is, again, in my mind, the way I like to think about it is the foundation of the house. If we don't have a solid foundation, then any work that we do on the roof is just not going to hold. And so we're going to be right back in the office, right? My goal is always to work myself out of a job. I want people to work with me when they have a problem. I want them to come consistently, and then I don't want to see them again. I don't want them to need me. Of course, we all know things happen in life. 6 months from now, next year, something comes up, call me. I'm not saying that I don't want to work with people again, but what I'm saying is my goal when I work with a person is that we are targeting the root of their problem. We're getting down deep. This is why I have deep, hard conversations in my office. Sometimes people are surprised by that, but then they realize how much better they feel when they leave. They realize that those things are connected where they might not have drawn connections in the past. I've had people have all kinds of realizations. Like during treatments, as I needle a channel, they have a memory come up and then maybe they start crying even. And they're like, wow, I didn't even realize I hadn't thought about that in years, but it was in there somewhere. So genuinely, I'm hoping this makes sense. The difference between a TCM treatment and the difference between a classical Chinese medicine treatment is going to be a lot of depth. So for all the people who got great results with TCM, that's awesome. But for those of you that have not gotten the results that you wanted, who are looking for more, who know there's more, this is what you're looking for. You're looking for the full scope of practice, the complete system of acupuncture. And it is challenging to find someone who practices this way because a lot of people dabble. A lot of people say, well, yeah, I've heard of that, or maybe I took a class or whatever. But again, just like the other acupuncturists I mentioned, saying that they mix and match. This is not a mix and matching thing. It's not like a little of this, a little of that, a dash of this. That's not how classical Chinese medicine is truly practiced, because we want to send a really clear message to the body. And the way we do that is really staying true to the principles of the practice. And so when we start mixing and matching, it just gets too messy. And when we're really clear, the body gets the message. And that is ultimately what Chinese medicine is about. When I think about how would I distill Chinese medicine or acupuncture down to one sentence, like how would I describe a treatment? I really think that somebody comes in because they need help with something, and I don't match points or even channels to the symptoms that they report. I'm listening to the whole picture, the whole story that they're giving me, asking questions to get a deeper understanding of the story. and then really listening to the body when I take the pulse, or again, when I treat remotely, I'm seeing that even without the pulse, with a deep conversation, we can get to the same place. I see really good results in patients that I work with remotely. And I think it's because of the conversation that we're able to have, because I take a lot of time with people. And I really love that I'm able to do that with people that work with me in this way. So just to recap, TCM truly is not traditional. It is just a small part, or it's created from a small part of the complete system of Chinese medicine. So I hope you found this useful. Connect with me on Instagram. That's where I am most of the time. Or if you're listening to this episode versus watching it on YouTube, please know that I am also on YouTube if you want to connect there. And let me know. Reach out if you have questions. Instagram is probably the best place to do that. And if you can please like and subscribe, that really helps me spread the message more. This is a labor of love. I don't have any sponsors, and I love putting podcasts together, getting this information out there. So if you can leave me a rating or follow the show, I would greatly appreciate it. Thank you guys so much. See you next week.